Anyone who can say what you covered last time? Who can help us?
Karibu namaliza. Ikifika
Yes?
uniambie, acha ngoja Karo.
Is this storytelling in our class? Who can tell us what you covered last time? David Zayed. David Zayed. David Zayed, kindly unmute yourself and tell us what you covered last time. It seems David is just online, but he doesn't want to talk. Purity Owino. Purity Owino.
Okay, the last thing we discussed about the endocrine system, and it talked about the hypothalamus and the pituitary gland, and yeah, that is what I can remember.
Okay. Anyone else? David Kariuki. David Kariuki. Can you tell us what you covered? David Kariuki. Vruti Patel. Vruti Patel.
Yes, sir.
What did you cover last time? Guys, you cannot say what you covered last time. So kindly, after every lesson, kindly go make sure and read whatever we have covered. That's the first thing you are supposed to do. Before you attend the next lecture, make sure you cover everything. You go and read everything that we have covered. Number two, I want you to look at the histological features of those structures of those organs that have actually gone through. You are supposed to know each histological features of those structures. And in fact, we're supposed to attend histology sessions whereby we want to look at those structures, how they're looking at microscope to make sure those structures you can really identify them. So you're supposed to be very, very serious and alert in these classes on whatever we're going to cover. So kindly make sure you're serious. I cannot ask a question and student cannot answer the questions. And these are the things that I've actually covered. Now, for us, we're doing specifically histology of endocrine system. So today we want to finish on the histology of the endocrine system. I think you guys are doing, have you done the gross anatomy of the endocrine? Have you started doing it? Hello, you guys are not responding. Have you
No,
done
we
the
haven't.
Yes?
No.
You
Started
haven't
doing
had
it.
any class.
We've had a class on gross anatomy.
What did you cover?
We started with the organs of the genitourinary system, such as the kidneys and the urinary bladder.
Okay. So, but you're going to do endocrine system. I'll talk to our lecturers to consider also covering that so that we can actually do them concurrent while I'm covering the endocrine system. So him also to cover the endocrine system so that we can go, you guys are able to understand what actually we are doing. So I'll talk to him to make sure he also covers the endocrine system. But for us, we're going to finish the endocrine system today. That is the histology part of it. Now, secondly, when are you guys coming to the lab? Because you're supposed to see these things through the microscope, what I'll be now talking. According to your schedule, when are you supposed to come to the lab? Class rep.
Let me confirm in a minute.
Okay, kindly confirm. So last time we said something about the histology of the endocrine system. Now, generally, the features of the endocrine glands, the endocrine system, which actually consists the glands and specialized cells. Now, these glands, they're actually having specialized cells that secrete hormones directly to the blood or interstitial fluid rather than what you say duct. So, meaning the general characteristic of of these glands, they are ductless. They don't have ducts that are able now to release these what you call the hormones to the system. Now, we said last time we said major endocrine organs. Number one, we have the pituitary. We have the thyroid gland. We have the parathyroid gland, adrenal gland or suprarenal gland, pancreatic islets. There are around 1,000. Pineal glands. Then you have hypothalamus. Then you have for reproductive system, the endocrine part in the reproductive system, whereby you have the ovaries and the testes. Then also during pregnancy, remember during pregnancy, also during pregnancy, also we have what we call the placenta. So those are some of the things. I was saying those are some of the things that we covered during our last lecture. Now, today, we want to look specifically, we want to start, but we say the characteristics, some of the characteristics of these endocrine glands. We say they are ductless, they don't have ducts, no ducts. They are therefore called ductless glands. Then they have rich blood supply, usually supplied by numerous fenestrated capillaries they have around them. And this actually allows the hormones to be transported rapidly to the bloodstream. Then we also talked about secretory cells. We have the cords, the cluster cells, the follicles, networks, and supporting connective tissue. Usually also we can see they have very thin capsules surrounding the glands. So those are some of the characteristics of these endocrine organs. And we have started, last week we started by looking at the thyroid gland. We look at the hypothalamus gland, the parathyroid gland. So today we want to focus on some glands that actually call. We start with the suprarenal gland. Are you able to see my screen?
Yes.
Are you able to see my screen?
Yes.
Now, today we want to start by looking at the suprarenal glands. Now, these are paired pyramidal, but where do you find suprarenal glands? Where's the position of suprarenal gland? Where are you able to see them? Your body. That is Simeo Emmanuel. Where are the suprarenal glands? You have already done the urinary system. So where is the suprarenal glands located?
Above the kidney.
Yes, pardon? Simeo, pardon?
Above the kidney.
Above the kidney. But medically, how are you supposed to say it? Medically. Is it in front? Is it behind? Is it anterior, posterior? Medically, how are you supposed to describe it? Yes, Simeo. Medically, how are you supposed to describe the position of anyone
Is
else?
it
Ben Clayton, how are you supposed to say it?
superior medial?
Yes, superior. It has superior parts, not it's a superior part of the kidney. So actually, where your kidney is, the position that you're able to now find your suprarenal gland, it at the superior part of your kidney, just above it, but medically say at the superior. Then we also have some structures that you are able to see at the anterior part of your kidney, posterior part, and also have the medial and the lateral. So remember that. You also have the inferior part, just below the kidney, it's what you call the inferior part. So you should be able to describe the position of that organ. You should you are able to now to discuss the position of an organ medically by saying at its position where it is either posteriorly, anteriorly, inferiorly, or superiorly. Now, from these notes, the paired pyramidal organs on the superior surface of the kidney, highly vascularized. Then we have three groups of 60 small suprarenal arteries supply each gland. The left suprarenal vein drain into renal vein and right suprarenal vein drain into inferior vena cava. So basically what you're saying here, we have the left suprarenal vein from the left side, what actually now which it takes the blood from the adrenal glands. It now drains its blood into the renal vein. Then on the right side, the renal vein, actually now the suprarenal vein, it actually drains its blood directly into what we call the inferior vena cava. So that's how the blood supply of the adrenal gland is. Now, from this diagram, we're able to see this is where the left suprarenal gland. This is the left suprarenal gland. You are able to see it drains directly into what we call what? It drains directly to call the renal vein. Then from the right side, we're able to see the right renal vein. which actually drains direct into the inferior vena cava. Are you able to see it? Are you able to appreciate that, class?
Yes.
Okay. We're able to appreciate that. Now, number two, this is now the blood. This is what you call the aorta, the descending aorta, but it has different. Now, this is the now the inferior vena cava. Now, this divided into two regions and surrounded by the dense capsule. Now, actually what you call the adrenal gland, it is divided into two regions, whereby you have the suprarenal cortex and we have the suprarenal medulla. Now, the suprarenal cortex, it has layers. It has three layers. And these layers are the zona glomerulosa, which actually mineral leukocytes. Then you also have the second one, what you call the zona fasciculata. Then the third one, we call it zona reticularis. Now, the third one is the innermost layer that you're able to see at the suprarenal cortex. Then followed by in the middle, we're able to see the zona fasciculata. Actually, it's a layer that you're able to see at the middle of it. Then the outermost layer, it is what you call the zona glomerulosa. This is the outermost layer you're able to see within the suprarenal cortex. Apart from the suprarenal cortex, we have another region, what actually called the suprarenal medulla. I think I've heard about it, medulla. This medulla, actually these two layers, you're able to see the suprarenal cortex and the medulla, suprarenal medulla. If you go to your kidneys, we also have this cortex and medulla. But in your kidneys, we don't call them suprarenal cortex and suprarenal medulla. You just call them the cortex and the medulla. Now, this suprarenal medulla, it has cells that we call chromaffin cells, which actually produce epinephrine and norepinephrine. Now, the function of this epinephrine, they're actually neurotransmitter and hormones. They transmit their neurotransmitter and actually they also produce hormones. And it's a neurotransmitter and an hormones. Okay, remember this. Let me repeat myself well. This what you call the epinephrine. It is a neurotransmitter and it is also hormone. Now, the importance of this hormone, what you call epinephrine, it is for fight and flight. For example, when you're in your house, then you see a snake. What will you do? What's the first thing you'll do? Edgar Kemboi. Edgar Kemboi,
Yes.
when you see a snake in your house, what will you do?
Run.
Yes?
I'll run.
You'll run away. Now,
Yeah.
you'll run away because of this, what you call the epinephrine. It is for flight and fight. Then, also, it is used as medication to treat many life-threatening conditions. When you are in a life-threatening condition, they're able to use epinephrine to treat you. Now, norepinephrine, this is the second one, what you call norepinephrine. It is also both neurotransmitter and it is also hormone. It is also used for flight and fight. Then it is used to increase and maintain blood pressure. Now, this one, it is also used to increase and maintain the blood pressure. And it's just for a short-term serious health condition. We're also able to use it for a short duration of time. Now, from this diagram, we are now able to appreciate the three layers that we're talking about. From the first one, what we call the zona glomerulosa, This you're able now to see the histological features of this zona glomerulosa, how it is looking like. The outermost part, it is this what you call the capsule, and we have the zona glomerulosa. Then from the zona glomerulosa, we're able to see the zona fasciculata, which is this one. Then from there, we're also able to see the zona reticularis, which is here. So these are actually the layers, the first layers of the suprarenal cortex. Now, the second layer, you're able to see it here, the suprarenal medulla. Are you able to appreciate this layer of the suprarenal cortex? Are you able to appreciate it?
Yes.
Okay, good if you're able to appreciate it. Now, this is the cortex, you're able to see it. Then we have the zona glomerulosa, cord and follicles like structure. This is the layer. Then zona fasciculata. This is the layer of the zona fasciculata. So these are some of the layers you're able to appreciate within the suprarenal cortex. Now, the adrenal cortex. Adrenal cortex. Now, what is the embryological origin? Where does this cortex embryologically originate from? Who can tell us the embryological origin of the cortex? I want you guys to be active. Should be
They originate
interactive.
from neural crest cells.
Yes?
The adrenal cortex are from the neural crest cells of the mesodermal origin.
I've not heard you well. Maybe you can repeat yourself last time. I've not heard you well.
They originate from neural crest cells.
Neural crest cell. Okay, very good. Another person?
The cortex origin is from the mesodermal mesenchyme, while the medulla is from the neural crest cells.
Yes, very good. Then that's where it originates from. Then it secretes variety of steroid hormone, all structurally related to their common precursors, what you call the cholesterol. Then you have features of steroid secreting cells. Abundant smooth endoplasmic reticulum. It has abundant smooth endoplastic reticulum. Then it also has mitochondria with tubular crystal in zona fasciculata and zona reticularis, shelf-like cristae in zona glomerulosa. Then lastly, it also have numerous lipid droplets filled with cholesterol, precursor for steroid hormones. Then secretion is by diffusion with no hormones storage. So those are some of the features of the steroid secreting cells. Now, the zona. Let us now look at this layer one by one. These three layers of the cortex. So we are starting with the zona glomerulus, which is the outermost layer, located immediately beneath the capsule, which actually the outermost layer of the three. Cells arranged in round clusters. Then it secretes mineralocytes, which are aldosterone. So that's the hormone that actually it now produces, it secretes. Then you have the zona fasciculata, middle layer, largest cortical zone. Then cells arranged in rows perpendicularly to the capsule with alternating wide media, frustrated capillaries, then secrete glucoids and androgens. So these are some of the characteristics of the zona fasciculata. So remember, this is the outermost layer and the largest cortical zone that you have in this cortex region. Then lastly, we have the zona reticularis, which is now the innermost layer, or what you call the occupies the deepest layer of the cortex. Cells arrange as anastomosing cords, some secretion as zona fasciculata, glucosides, and androgen. So that's the innermost layer that you have, and it secretes these hormones. Now, medulla oblongata. Where does it originate from? Medulla oblongata. Class, where does it originate from? Are you able to hear me, class? Where does it originate from?
Did you say medulla oblongata or what? Or the adrenal medulla?
I say adrenal medulla.
Oh, it's from the neural crest cells.
From the neural crystals. Very good. Who is this? Rosemary Wanyonyi. What is your answer? Rosemary Wanyonyi? Pardon, I've not heard you.
From Europe, say.
Okay. Now, that's the origin of it. Has a similar origin to that of sympathetic nervous system, and it will consider highly specialized adjunct of this system. Then the adrenal medulla secrete the catecholamine hormone, what you call the adrenaline, epinephrine, noradrenaline or norepinephrine. So that's actually what it produces, what you have talked about. What are these? Both are neurotransmitter and hormones. Then secondly, remember, this is now what it plays an important role in fight or flight. So that's the important role that it actually plays. Then also remember that you have said it can also be used to increase or maintain blood pressure in a limited short-term serious health condition. It can also be used to actually to increase or maintain the blood pressure. Now, from this, I want you guys keenly to look at this structure, how it is looking like. I want you to identify what you call the sinusoids. This is now adrenal medulla. Then also look at this, what you call the chromaffin cells. Kindly look at that for 1 minute. Because these are what you're going to see actually while doing now your practical. Yes, Boaz, are you able to appreciate those structures?
Yes.
Okay, very good. If you're able to, what are you able to see? What are you able to see? Rajab, Boaz, what are you able to see?
Sinusoids and chromaffin cells.
So are you able to identify it when you see it under microscope? Are you able to identify them when you see them under microscope?
Yes, sir.
Okay, very good if you're able to identify them. Now, exposure of chromaffin cells, we have modified adrenergic neurons without axons or dendrites. So I believe you did your nerve anatomy, what you call the neuroanatomy, and were able actually to identify the axon and the dendrites. Then this represents sympathetic ganglion cells. We have polyhedral cells which containing abundant dense cores, then secretory granules. Then we also have chromaffin, cells synthesize and release epinephrine and norepinephrine. So these cells that are able to see what you call the chromaffin are able to release, or they're able to secrete the epinephrine and norepinephrine. Then we have another organ that you call the endocrine pancreas. The endocrine pancreas. Now, pancreas is actually an exocrine gland, but it also has some parts of endocrine part. So it plays those two roles. It has endocrine and exocrine. Is that okay, class?
Yes.
Yes, class. Is that okay?
Yes.
Daniel Kamau. Daniel Kamau.
Yes.
What have I said?
You are talking about the endocrine pancreas.
Yes, what have I said about the endocrine pancreas? Yes, what have I said? Daniel Kamau. Seems Kamau is not serious, is not attentive in this class. Joy of Physiotherapy, Joy. Registration number 8183. Can you unmute yourself? What have I said?
You have said that the pancreas plays both exocrine and endocrine functions.
Very good, very good. That's what I've said. You are very attentive. Now, the main secretory product of the endocrine pancreas are what you call the insulin. Now, this insulin, it's actually the one that regulates the amount of blood, or what you call the glucose in your body. So when your glucose is high in your body, they actually introduce this insulin in your body so that it converts this glucose into glucogen, what it can be stored. Then when it is low, now the glucogen, it is now converted again into the glucose. Is that okay? Then you have polypeptide hormones, which are play an important role in carbohydrate metabolism. So it has those two hormones that actually produce. We have the insulin and the polypeptide hormone. Now, this is what you call the pancreas. This is our pancreas. Now, the pancreas, it has head. This is what you call the head of the pancreas. Then you also have the body of the pancreas, which is here. Then you have the tail of the pancreas. Then in the middle here, you're able to see the pancreatic duct. This is what you call the pancreatic duct, the duct of the pancreas. Now, it releases its hormones directly to the second part of the duodenum. Now, this is what you call the duodenum. It releases its hormone just direct to the duodenum. Are you able to see where the duodenum is? Are you able to see from my pointer? Are you able to see it?
Yes.
Are you
Yes.
able to see the side where now we have the duct of the pancreas, where my cursor is? Are you able to see it?
Yes.
And here, this is the other one. Are you able to see it? The duct.
Yes.
Yeah, now that is actually the second part of the pancreas. Now, from here, you are able now to appreciate the parts of the pancreas, what you call the exocrine cells, what you call the pancreatic acini. This is what you call the pancreatic acini. Now, actually, you're able to see it is different from what you call the pancreatic islets. This is what you call the pancreatic islets or islets of Langerhans. These are you able to appreciate these structures?
Yes.
Okay, very good if you're able to appreciate. Now let us continue. Now, endocrine cells are contained in spherical bodies called what you call the pancreatic islets or islet of Langerhans. Then there are about 1 million scattered along the what you call the exocrine cells. Then these are now the cells that were able to see within the pancreas or what you call the islets of the pancreas. So these cells, we have the number one, the alpha cells, which are now the glucon. Then have the second one, what you call the beta cells, which are now the insulin, produce the insulin. This one, alpha cells, produce the glucagon. Then we have the delta cells, which are somatostatic growth hormones, inhibiting hormone. Then lastly, we have what you call the F cells, what you call the pancreatic polypeptide, PPP, and other digestive hormones discussed in digestive chapters. So we're not going to discuss them. But these are some of the cells we are able to see within the islets of what? The pancreas. Now, try to look at this structure, the islet of the Langerhans. Try to look at this structure. Can you look at it keenly? Yes, Ken. Hello, Ken. Can you unmute yourself, Ken? Hello, Ken.
Yes.
What are you able to see here? What are you able to see in this diagram?
Honestly, I cannot even see those arrows, so I can't specifically distinguish anything.
You are not seeing anything.
Yes.
Okay. What can you see there? Ken, what are you able to see there?
I can see the alpha cells, beta, and surrounding it are the exocrine pancreas cells.
Are you able to describe for us the differences between the alpha cells and the beta cells, since you can see they are all actually very close than the exocrine pancreas? So are you able to differentiate between those two?
I could say the difference is the difference between the exocrine cells and the alpha and beta is that the beta and alpha cells are enclosed between the islets of Langerhans.
They are enclosed?
They are encapsulated in the islets of the Langerhans.
Let's have the Langerhans. Very good. Now, the last one we want to look at, it is the pineal gland, what we call epiphysis cerebri, the pineal gland. So these are conical shaped glands, 5 to 8 millimeters in length and 3 to 5 millimeters in width. Then it develops from the roof of the diencephalon and remain attached by the short pineal stalk. Then it's actually being surrounded by capsules composed of pia mater. So this pia mater is actually found within the brain. So we call them pia mater. They are around 3 matters in the brain. Then connective tissue septa derived from the pia mater penetrate the gland and subdivide it into distinct lobules. So it has lobules. Then have the sympathetic axons and the blood vessels enters the gland with septa. Then the cells that actually now produce the hormones in the pineal body, we have the first one, pinealocytes. This is now the major cell type that we have within the cell, the pineal body, which actually now present the modified neurons. Then automastic nucleus, what we call the spherical to ovoid with a prominent nucleus. Then you also have the cytoplasm, not evidence with conventional stains, but however, silver staining reveals that the cell generally has two or more extensions similar to neuronal process. Then you have the process end in association with capillaries. Then it also able to secrete the melatonin, which is a dynamic hormone. So these pineal sites, they actually produce they secrete what we call the melatonin hormone. Then secondly, we have the interstitial cells. Interstitial cells. Now, this is the minor cells type that you're able to see within the pineal body. Then similar to astrocytes in the brain. Then the nucleus is elongated and more heterogomatic than that of the pinealocytes. Then it actually possesses long process with intermediate filaments. Then lastly, it is located among group of pinealocytes and in connective tissue septa. Then lastly, what you call the corpora and or what you call the brain sand, the brain sand. So these are globular basophilic accumulation of calcium phosphate and actually it's a bicarbonate in interstitial space. We have radio opaque and thus open used to indicate the medial inflection of the brain resulting from pathological condition. So I want you guys to appreciate these three cells that we have talked about. Can we look at this histological diagram? And I want you guys to be able to appreciate the pinealocyte, the neural gland, and the brain sand from this diagram. Victoria Munene. Hello, Victoria Munene. Yes,
Victory.
look at that diagram, then you tell us something.
I think I can be able to see the brain sand labeled S, which is like they are cells that are basically very large in size. Can also see the N, the neuroglia labeled N, and I can also see the pinealocytes labeled P. Yeah.
Okay. Who is this here? Monica Sitato. Monica Sitato. Monica Sitato. Monica Sitato.
Yes,
Yeah, can you tell us something about what you're seeing there?
I can see the brain sand. They look bigger than the rest. And I can see the neuroglia. It looks like it's forming something like a path. And then in between it is the P, the pianocytes.
Okay, good. Make sure you're able to identify these structures in exam. Now, lastly, endocrine tissue of the reproductive system. Now, the reproductive system, we have the endocrine tissues that is in the male and female. In the male, we are talking about the testes, and in the female, we are talking about the ovaries. Now, in the testes, we have what we call the interstitial cells, which actually produce androgen, what you call the testosterone. Then this promotes production of functional sperms, then maintains secretory glands, influence second sexual characteristic, and actually stimulate muscles growth. Nacelles, which actually now secrete, inhibit. Then you have the ovaries. Follicular cells produce estrogen and secrete inhibin. Coprolateral release progestin and relaxation. So this is about the what you call the testes and the ovary. So remember the testes, we are only talking about the testosterone hormone. Then ovaries, we're talking about the follicle cells, which actually now produce the estrogen. What's actually the function of the estrogen in the female during menstruation, during pregnancy? Anyone who can help us?
Can I?
Yeah, you can try. You can try.
So estrogen during pregnancy, it expands the myometrial size and blood flow to support the growth of the fetus. And then it also prepares the breast, like stimulates mammary duct to develop, like for future, to help in future lactation. And then it increases, I think those are all the two that I know of.
That's a good try. Now, when it is increased or reduced, yes, can you tell us at high level or low level?
So when it's in high level, so during pregnancy, it triggers labor by preparing the uterus for contractions. Then if it's in low levels, it signals early miscarriage, or it delays the labor by preventing the uterine contractions.
Yes, that's what I wanted to hear. Actually, estrogen is the one that actually now maintains the pregnancy at high level. Is that okay? When it is low, your pregnancy will actually be terminated. Is that okay? Yeah, class, any
Yes.
question? Any question? So, we have finished with the endocrine system. And I just want to repeat for you guys on what you're supposed to read on the endocrine system. And your class rep should send me their email so that I can send you notes that you can read. Some of the books that you're able to read on this endocrine system. So remember, while reading on the endocrine system, we are going to look at these major endocrine organs. The first one is pituitary gland. The second one is thyroid gland. The third one, parathyroid gland. We have the adrenal gland, pancreatic islets, that is the pancreas, the pineal gland, hypothalamus, ovaries, testes, then the placenta during pregnancy. So read around those glands. Read around those glands. Kindly make sure you look at the histological characteristic of all those glands. Then you're also supposed to have a lab session to look at the microscopic, the characteristic of these glands, whereby I'm going to discuss with the class rep for dental and the physiotherapy class rep and the nursing class rep. Then we can organize within this week on when are we supposed to do now the practical. This practical, we are now going to divide you guys into two groups. Going to divide you into two groups so that that's a number that you can actually accommodate during practical. So be ready. will tell you the first group and the second group. If there's no any question, I wish you all the best. Next week we'll meet and do the other two systems that have remained. We're going to handle one system, then the other week we're going to finish with the last system. So I also expect the gross anatomy to continue this week. Continue doing the gross anatomy this week. Wish you all the best if there's no any concern or any question. Bye-bye.
Bye. Have a good day.